Welcome to the show, everyone. I'm so excited about networking with everybody out there. We're live on Facebook, so hello to everybody out there. This is going to be a great segment. I'm really excited about bringing on my first guest, who is Dr. Franklin Gergitz, and he is the owner of Sinus and Allergy Wellness Center. I want you to tell everybody first a little bit about yourself. You have been here now a couple of times. Welcome back, and a little bit about what you do.
Well, thanks, Carol. Thanks for having me. My name is Frank Gergitz, ear, nose, and throat physician in private practice in North Scottsdale. Our office is right off of the 101 and Princess. And our practice is focusing on airway inflammatory conditions, mostly nose, sinus, and allergies. And in our office, we actually have an in-office CT scan. So patients will come in with some problems, and instead of having to give them an order to go get a CT scan, we have it right there. So when they come in, we get the CAT scan done, then we actually review it right with the patients. So as a patient sitting in that chair, we're reviewing their findings right there in front of them.
Right off the bat, I'm going to ask you a different question, okay?
Sure.
So, because I want to know if people can they call on their own, or do they need to have a referral?
No, they can call on their own. Most times the insurance companies will allow them to do their own, appointment scheduling. Now, sometimes certain insurance companies do require a referral, but most times, if the patients are having some issues and some problems, they can call and get on the appointment schedule same day, next day. So
that's awesome.
Right there for them.
Now, it's monsoon season.
It is.
So we're going to talk a little bit about that and what happens to your airways, as you put it. So every year around monsoon season, people start saying that their sinuses are acting up. Is that actually a thing, or are we just blaming the weather?
No, it's real.
It's real.
Absolutely. So the monsoon season, when it comes, oftentimes we associate those storms with haboobs. So the pollen, gets activated. The dust clouds are so intense that it's just, we can't even see to drive. But think of what's going on inside that cloud. It's not just the dust and the pollen or the dust that's being stirred up, it's also pollen. Even mold. Mold is inside the soil, and when the storms come through and the winds act up, all of that particulate matter gets airborne, and the dust clears within a day or so, but because the weather here is so hot, some of the smaller particles of the pollen and the molds will go up into the upper atmosphere. So now it's up in the air. It's going to come down, it's going to blow around, but it's going to start to come back down to the Earth's surface over the next couple days. So even though the pollen or the dust clouds have cleared, the pollen and the mold is still airborne.
Boy, oh boy, it's really nasty when that happens.
It is.
The last time you were on, one thing I noticed with you is that you're not just all about just giving medication right away. I think you like to try and do things more on I don't want to say natural, but a different, instead of running to go get your antibiotics and things like that.
Absolutely, yeah. So, we really advocate using that sinus rinse. That saltwater wash can just clean out the lining inside the nose. And then also some of the over-the-counter medications like a steroid nasal spray. Oftentimes patients think steroids bad. But the steroid nasal spray, when you spray it inside the nose, it's a very dilute solution, so it goes inside the lining, and what it does is it just kind of takes away the inflammation on the lining. It does not get absorbed into the bloodstream. We think of spraying something inside our body, but really the inside of the nose is really still outside the body.
Oh, that's good to know.
Yeah, when the spray gets inside there, it's reducing the inflammation inside, reducing congestion and swelling, so patients can breathe clear and they can start to smell a little bit better, because the congestion just blocks up those smell fibers, and sometimes patients have trouble smelling.
Sometimes people, I think, feel like that they're getting that sinus infection, and it may not necessarily be right away. Maybe what would be a symptom that they would know that it's a little bit more than just dust in the nose?
Yeah, so great question. And sometimes we can think of the facial pressure, facial pain.
I hate that.
Exactly, yeah. Green yellow drainage, the infected looking stuff, and then stuffiness and congestion, nighttime sleep, it becomes very, very difficult for patients who have allergies oftentimes precede sinus troubles too.
Absolutely.
Yeah.
Now, your phone number to call, it's 480-525-8999. I think the best thing is to check him out on the website, and he's got two. We're going to do today sinusaz.com, and you don't necessarily need to have a referral, but maybe you call your insurance company, you find out. But usually when people call, it's when something's wrong.
Right.
Do you feel that people should be more proactive instead of reactive to what just happened?
Absolutely, yeah, especially during this time of year. You know, we think about the different times of the year as far as the pollen counts and pollen seasons. You know, springtime is the tree pollen season. So I'm a big tree pollen allergy person myself. I have asthma myself. So
Wow.
I know that the allergy season is upon me because it may start to make me cough or I get stuffy. And then, so I'll take my pollen medication, my antihistamines and my pollen medicines that help me get through that season. And then all of a sudden, you know, I'll start to stop my medications at the end of the springtime season. But then, boom, right here we are back into the monsoon season, and that stirs everything back up again. So, you know, when people say they've got year-round allergy symptoms, it's real.
Absolutely. You talked about mold, and say that people say that mold here in Arizona, it's too dry for mold.
Right.
That's impossible.
Yeah, it's a very common misconception, and
Yeah.
we actually talk to a lot of patients about those problems. And you know, we think about the mold, and the mold's in the dirt. It's underneath that top layer of soil. So when the winds come through, that stirs up that mold count. So we can also see it inside our homes.
Yeah.
You know, anywhere that there's moisture, you know, can have mold. So if you've got a leaky faucet in the bathroom, underneath that cabinet, you may actually have moisture in there. And if there's moisture, there's probably mold. And then we also see it with the HVAC, you know, the cooling systems and such. Sometimes there can be condensation that occurs inside the house or up in the attic, and there could be mold up there as well.
So, okay. A lot of people right now, I'm going to go to this one, their allergies exploded after the storm, okay?
Right.
They're probably not imagining it, right?
True, right.
So what do they do, okay? When do we call you?
Yeah. So, you know, if it's been something that happens, you know, year after year, every, you know, monsoon season is about mid-June and it goes all the way through September. So if patients are getting antibiotics in the summertime, or if last year they really suffered during that season, then if we can actually help to see those patients before that season, we can actually do the allergy testing. We can evaluate their airway for inflammation, and maybe their sinus cavities are just too narrow and too blocked. Then the inflammation comes into the nose from the pollen, from the mold, from the dust, and then that activates the lining inside the nose, so it becomes swollen and congested. So if we can be ahead of the game, you know, prevent those symptoms from happening, that involves allergy testing, and you know, sometimes in an X-ray picture, like a CT scan that we do in the office. We do a nasal endoscopy as well, just to get a real good view of the inside of the nose and see if we need to do anything different.
Right. And if they do have to do something different, what would that be?
Yeah. So sometimes it's allergy testing. Sometimes it's we do some in-office procedures to just open up those blocked sinus cavities very gently and then expand the airway, expand the sinus drainage pathways.
He's off Princess and the 101 in North Scottsdale. You may not necessarily need a referral, so you can talk to your insurance company, but the main thing is you shouldn't be suffering, right? And there's going to be a point when, you know what, it is more than just dust in the nose. And right now, especially, I think it's going to happen today, folks. We might have one of those monsoons, and we all know how that dust, it settles on the ground, it settles in your nose, it's awful, and you don't have to suffer. I think that's the main thing, is what you don't want people to have to suffer.
Right.
And you may be allergic to some of these things that are floating around there. The number to call him is 480-525-8999. Check him out on his website. It's sinusaz.com. Hang tight, we're going to be back in just a minute. Okay, so here we are here. I'm going to do a couple more of these, because these allergy ones, and then maybe swing over here.
Sure.
Well, wait, here, when it says here, before monsoon, is there something that they can do? What should they do?
So that would be more allergy medications, sometimes an evaluation like
Okay,
we would do.
then we're going to do that.
Okay.
I'm not gonna do that one. I'm gonna
Okay.
go bring down that. I might bring that down here,
Sure.
okay?
Mhm.
So I threw a few things, right?
Good.
But that's
I like
okay,
it. Yeah.
you're fine. And you see how the more you do it, the better it gets.
Yeah.
With what you do, okay? Some of the more bigger cases, what are they?
I mean, like surgical cases?
Yeah.
So like a septal surgery, sometimes patients will have nasal polyps. Nasal polyps can just block that breathing pathway. And it's interesting, when we look inside the nasal cavity, we normally can see from front to back. In patients who have nasal polyps, we may see an obstruction. It's just there's no visibility from front to back. So if I can't see from front to back, that means that the air is not getting from front to back.
So do you have to do surgery?
We do, yes.
Really?
Yeah. In fact, we did one today.
Wow. So how do they get a nasal polyp? How does that happen?
It's an inflammatory process. We don't know exactly why patients have them, other than we can think about there's different types of inflammation that occur inside the nose and the sinus cavities, and some patients are more predisposed to that. Not truly a genetic, situation, but we do see some from time to time some patients who said, geez, my dad has allergies and just can't breathe through his nose. And we see the patient's nose, and then we go back and say, hey, have dad come in to make an appointment, and sure enough, we may find some polypoid changes in dad too.
Do you ever deal with, because there's a lot of times when you know how people just can't breathe? Right? And you obviously are going to do allergy testing on certain people for that. What happens, let's say, it's more than that, and they're deviated, whatever.
So that's a surgical procedure. So we actually take the septum, instead of being nice and straight and it's shifted, what I do is inside the nose, I numb everything up. This is a patient's normally under IV sedation, so they're getting medicine. And then we actually remove the abnormal septal deviation, dissolvable stitches in place, some splints for a week to keep the septum nice and straight. And when the patients get those splints out, they get that air high. Wow. It's almost like, wow, I've never breathed like that ever.
And you do that kind of a thing as well?
We do that right in our office even.
Oh, that's awesome. We're going to talk about that next time, okay?
Exactly, yeah.
So how many people out there deal with allergies? A lot, I know, and it's awesome when you have that and you don't know what to do. This is what this show is all about. What I love is the information that people get. And, when we're talking about sinuses, there's a lot of different things we're going to be talking about right now where you have you think you might have an allergy. Maybe you do, maybe you don't. You have to be tested. So how do you do an allergy test?
Right, so we do that skin testing, okay? So it's usually on the arms. So what we'll do is a small little prick, a little bit of allergen is introduced underneath the skin, and then we just wait for the patients to make a reaction. So sometimes the patients will have the testing done, nothing comes up. And then other times patients will have their testing done and every bump becomes swollen and itchy sometimes. So we know that those patients are very allergic.
Wow, you know what? And when that happens, you need to have the help of a professional, right? Now, I wanted to ask, before the monsoon season hits, what do you suggest for people to do?
Right, yeah, so we've missed that this year, right, because our monsoon season is already here.
Right.
But prior, thinking next year, if the patients have inflammatory conditions inside their nasal cavity, like just can't breathe well through their nose, or they've got pollen sensitivity, maybe their dog at home is causing them to be stuffy.
That's not fun.
Yeah, so some of these things we can actually do some allergy testing before the season strikes. The other thing is medicine. Sometimes patients can take those antihistamines over the counter. A steroid nasal spray, again, is a nice way to reduce the inflammation inside the nose. And you can take the antihistamine and the steroid nasal spray at the same time. They don't coincide with each other, they don't conflict. So those are some of the things that you can do. And then even if you're going to be outside during that season, some saltwater rinse, just to wash away that pollen and that dust and the mold that's inside the nose before it has a chance to react.
Make sure you do it. This is the thing about people.
Right.
They don't do it.
Yeah, exactly.
Right?
Yeah.
Okay, let's go to this one. Ear pressure and headaches, okay? So why do ears seem to plug up just before a storm.
Right. So the drainage pathway in the nasal cavity, in the breathing pathway, the nasal cavity goes from front to back, and the back part of the nose, it gets narrow, almost like a funnel. Okay. So the very narrow part in the back part of the nose is the opening for the eustachian tubes. Now those are the tubes to the ear that equalize the pressure behind the eardrum. And we know those tubes as the ones that pop when we go up and over the mountain or you fly in the airplane, right? So if those narrow drainage tubes are swollen already from chronic allergies, now before the storm hits, the barometric pressures change, and the pollen counts can climb, mold counts can climb, dust climbs. All of those can add to the irritation to the nose, to the lining, and to cause swelling. And if it occurs in the back of the nose where those eustachian tubes open up, that's when they start to see the ear symptoms.
Yeah, but let's say they get hurt. They can really hurt.
Absolutely, sure.
Sometimes you have to remove those?
Sometimes we would maybe put a tube in the eardrum, if fluid builds up behind the ear, or even prior to us having the balloon procedure that we can actually gently dilate those eustachian tubes. In the office, we do that, in the office under local anesthesia, pills that actually help them sedate, a little bit sedation, and then that way, in a very gentle way, we can stretch those tubes open so that way they won't have this problem moving forward.
You don't have to suffer.
Don't have to suffer.
The phone number to call is 480-525-8999. Check them out on the website. It's sinusaz.com. Okay, headaches.
Headaches, right. Same thing. The same conditions that can affect the ears that we just mentioned can affect the sinuses. The sinus have small little drainage pathways. And when we have allergies, think of the congestion and the swelling that's constantly there. Oftentimes patients, that'll be their new norm. They live with that. They don't realize that I have problems with allergies or from sinus issues. And then the pollen season comes, and then that causes added irritation in springtime. Now we're into the monsoon season. Right before that storm comes, again, barometric pressures change, and when those small little drainage pathways swell closed from that change in the pressure and the irritants added in the monsoon or the haboobs, now all of a sudden it causes the sinuses to close. The mucus that's inside gets trapped, and the bacteria that's inside there have a chance to proliferate and to grow. Before you know it, that's the preceding cause of sinus infections.
So what is your youngest patient?
14.
14, so 14 on
and
up.
older, right.
Okay, I just want to let people know that.
Sure.
And then what about, migraines? Because
Right.
a lot of people suffer from
They
those.
do, yeah. And oftentimes patients feel that a sinus headache is actually caused from the sinus infection, but that's not true. Most sinus headaches are actually migraines. But migraine problems and sinus problems and nasal inflammatory conditions like congestion oftentimes coincide. So if we can reduce the nose, the sinus inflammation and those symptoms, we can oftentimes help patients who suffer with recurring or prolonged migraines. We can actually help to reduce that by taking care of the nose and the sinuses. And we work with our neurology doctors that take care of those patients.
So, because that's really important. There's a lot of people out there that do suffer from migraines. Where are they coming from? That's the first thing, right?
Yeah, right. So, and it's hard to say, because the migraines can be, there are lots of different causes for the migraines. But again, if it's related to a sinus problem or a nasal condition, we can treat those and we can help.
How do you know when it's something a little bit more serious?
Oh, so right. So sometimes if it's patients are on medication, antibiotics over and over again, or they've been on medication, 10 days have gone by, they're just not getting any better. The 3 to 4 infections per year, is another trigger. And even if your allergy medicines just stops working, those are things that show us that your symptom is more than just a cold or the flu-like symptoms. But then some of the more alarming symptoms would be that headache, the worst headache that you've ever had, fever, high fevers, facial swelling, visual changes. Those are some of the more alarming symptoms, and they should call their family doctors or even go to an urgent care or to the emergency room for some of those severe cases.
I think a lot of people out there, they, like you said, it's just the norm. They don't realize that they don't have to be dealing with it, and they're constantly on medication, especially that antibiotics.
Right.
They just go, and that's what they think they need.
Yes.
And I don't think some of even these urgent care places where you go, that's what they're going to do. They're just going to give them that, and it's just a cycle that never ends.
It is, yeah, and it's frustrating because from us, when I see patients that come into our office and have been on multiple antibiotics, instead of seeing a person that we can treat, in an easier fashion, we have to think about the resistant bacteria that are inside there, or the biofilms where these bacteria are kind of like living, and you just can't get rid of them with an antibiotic that you would take over or by the mouth that their primary care doctor would treat them for. So we have to be a little bit more aggressive.
So what should people do to avoid all of this?
It's really coming in to see, getting checked, getting evaluated. Their primary care doctors oftentimes are a very good source for resources as far as, who to go see. So the primary care doctors may have the ear, nose, and throat doctor that they recommend regularly. So the primary care doctors are great sources, but if you're on too many medications and you're just not feeling better, that's the trigger to maybe ask for a referral to see an ear, nose, and throat doctor.
Well, here you got one.
Right.
And that phone number to call is 480-525-8999. It's important that you find out what's going on, right? And so many people, I happen to know a lot of them that are constantly, they sound like they have a cold all the time. They're constantly wiping their nose.
Right.
Yeah.
Yeah.
And they'll say, I got allergies, right? But you can maybe fix that by finding out what are you allergic to.
Exactly, yeah. And sometimes it's confusing, is it a cold or is it allergies? So, some of the clues from my recommendations would be itching. So if your nose is itching, if your eyes are itching, the back of the throat, think of allergies in those scenarios. If you've been around somebody that's sick, and they have a virus, that may be what you've got. You caught the virus from, a child or a daycare, for example.
So, okay, this one here, can allergy testing make a difference?
Oh, no doubt, right. So, 25% of the patients out there have allergies, but not everybody knows that. So oftentimes, if we can get those patients understanding what they're allergic to, the most important thing is first to avoid it. Sometimes it's easy, sometimes it's impossible. The veterinarian allergic to dogs or cats,
yeah, I hate that.
Right? Or your dog, you're allergic to your dog. Well, you're not going to get rid of your dog. But as far as avoidance techniques, what we do is we may say, instead of having the dog sleep in your bed with you at night or even in your bedroom, let's get your dog comfortable in a new spot outside that bedroom. Keep that bedroom as healthy as we can, because we spend most continuous hours of our day asleep in our beds.
What about the trees and everything that's around us that we're around?
Right. We can't avoid those either, right? So we try to minimize those exposures as best we can. Maybe if you're going to go out for exercise, for a run, try to consider that to be in the earlier part of the day when the pollen counts are lower. And when you do go out, after you're done, again, that sinus rinse, wash that pollen out of your nose before it has a chance to react in the lining and cause problems.
But if you are dealing with something that's constant, chronic, you know that you want to have to get that checked out. You can call them. You do not necessarily need a recommendation. Call your insurance company, find out, so they can help you. They've got everything in-house. That's what's wonderful about them. They have same-day appointments if needed. So their phone number is 480-525-8999. Check them out on the website. It is sinusaz.com.